Hi everyone, this is our weekly blog, and some questions came about these smaller pulses, compressed pulses, and what they mean. And I've talked in the past about how they mean that there's junk in the body, basically little cysts, fibroids, little growths, and they're determined. You can feel them because they will produce this compressed pulse in the different positions depending on which organ the little growth is in. And so I wanted to talk about that. Okay, let's start with the right sun or the right yang wei. Right yang wei is your lung, right sun is your sinuses. And the right sun is also the large intestine. And so very often, and the key to feeling these things is don't push so hard. That's why one of the first things you need to learn, and it will be a mistake that you will make a lot, and you just have to stop doing it. And that is you push too hard. So when you go to examine someone's pulse on their wrist, always just touch the skin first. No matter what the position is, touch the skin and see if there's anything at the skin level. Then you go a little deeper to the superficial level and so on. You start with a light touch. That way you don't miss something. Because if you push hard immediately, you could push right through something and not feel it. These compressed pulses, there's a lot of misunderstanding about them over the years, even from, I think, my teacher, because it was thought that these are actual abnormalities in the radial pulse, the radial artery. In other words, the radial artery is kind of coming along like a nice little tube, and then suddenly in the wall of the artery, the outer wall of the artery, there's a bulge producing this little sharp or pointy or bird's peak, bird's beak, or what I call a compressed pulse, a tiny little thing, like feels like a tiny little stone. But I don't believe that. I don't see that. I don't believe that there's these anatomical little pointy things in the radial artery. What you're feeling is something